In your grandmother's kitchen, garlic was never just a spice. It was the first thing she reached for when someone came home with a cold. It was in the broth she made when someone had a fever. It was rubbed on wounds before a bandage was applied. It was braided and hung by the door, not for decoration, but because she knew what it kept away. Garlic has been used as medicine for over 5,000 years. Ancient Egyptians gave it to the workers who built the pyramids to maintain their strength and prevent disease. Greek and Roman soldiers carried it into battle. Louis Pasteur, the father of germ theory, documented garlic's antimicrobial properties in 1858. During World War I, when antibiotics did not yet exist, garlic was used in field dressings to prevent gangrene. And your grandmother kept it in her kitchen because she inherited a wisdom that stretched back further than she could remember. Today, we are counting down 21 garlic health benefits that most people have completely forgotten about, the ones that lived in your grandmother's knowledge and have been quietly buried under a century of pharmaceutical marketing. And number one is the benefit she considered so important that she made sure everyone in her family understood it. Let's begin. Natural antibiotic properties. Before penicillin, before the age of antibiotics, garlic was one of the most reliable tools available for fighting bacterial infection. And here is what most people do not know. Modern research has confirmed what your grandmother already knew. The compound allicin, released when garlic is crushed or chopped, has demonstrated antimicrobial activity against a broad range of bacteria, including some that have become resistant to modern antibiotics. A 2011 study published in the Journal of Antimicrobial Chemotherapy found that a garlic-derived compound was effective against a strain of Campylobacter bacteria that had developed antibiotic resistance. Your grandmother crushed her garlic. She never sliced it. She knew, without the science to explain it, that crushing released something important. She was right. Allicin is released only when the cell walls of the garlic clove are broken. Slicing releases a fraction. Crushing releases the full amount. Always crush or mince your garlic. Never slice it and call it done, reducing blood pressure. High blood pressure was not the epidemic your grandmother's generation experienced the way ours does, partly because of diet, partly because of stress, and partly because of the daily habits they maintained that most of us have abandoned. Garlic contains compounds, including allicin and other sulfur compounds, that cause the smooth muscle in blood vessel walls to relax. When blood vessels relax, they widen. When they widen, blood pressure drops. A meta-analysis published in the Journal of Nutrition found that garlic supplementation produced significant reductions in both systolic and diastolic blood pressure in people with hypertension. Your grandmother ate garlic every single day, not as a supplement, not in a capsule, in her food, in her broth, in her remedies, daily and consistently. If you are on blood pressure medication, speak with your doctor before significantly increasing your garlic intake. But understand this, your grandmother's daily garlic habit was not accidental. Boosting immune function. The moment someone in your grandmother's house began to feel unwell, garlic appeared in everything, the soup, the tea, the broth she pressed into your hands before you went to bed. She was not being superstitious, she was being strategic. Garlic stimulates the production of white blood cells, the body's primary immune defenders. It increases the activity of natural killer cells, specialized immune cells that identify and destroy virus-infected cells before they can replicate. A landmark study published in Advances in Therapy found that people who took a daily garlic supplement had 63% fewer colds than the placebo group. When they did get colds, they recovered in an average of 1.5 days compared to 5 days for the placebo group. Your grandmother's garlic soup was not comfort food, it was targeted immune support. She just did not have the language to explain it in those terms. Lowering LDL cholesterol. Your grandmother cooked with garlic every day. She did not have cholesterol medication, she did not need it. Garlic has been shown in multiple clinical trials to reduce LDL, the form of cholesterol most associated with cardiovascular disease, by 10 to 15% with consistent daily use. The mechanism involves garlic's sulfur compounds inhibiting the liver enzyme responsible for cholesterol synthesis. The same enzyme that modern statin medications target. Your grandmother was unknowingly supporting her cardiovascular health every single time she added garlic to her cooking. She did it every day, for decades, and it compounded. Small daily actions sustained over years produce outcomes that no occasional intervention can replicate. That was perhaps the most important thing your grandmother understood about health that most of us have completely forgotten. Fighting fungal infections naturally. Before antifungal creams, before specialist treatments, garlic was the remedy your grandmother reached for. Athlete's foot, nail fungal infections, skin irritations caused by fungal overgrowth. Garlic's allicin has demonstrated significant antifungal activity, particularly against candida, the most common cause of yeast infections and oral thrush. Crush 2 cloves of garlic and mix them with a small amount of carrier oil. Coconut oil works beautifully. Apply to the affected area. Leave for 20 to 30 minutes. Rinse thoroughly. For oral thrush, chewing raw garlic and allowing the juices to coat the mouth before swallowing has been used for generations. Your grandmother had no embarrassment about these remedies. She had results. And results were what mattered, reducing inflammation throughout the body. Chronic inflammation is at the root of most of the serious diseases of modern life. Heart disease, type 2 diabetes, arthritis, certain cancers, Alzheimer's disease. Your grandmother did not know the term chronic inflammation, but she understood that the body needs to be kept in a calm, balanced state, and that certain foods helped maintain that balance. Garlic contains diallyl disulfide, a compound that suppresses the expression of inflammatory proteins in the body, including cytokines, the signaling molecules that drive the inflammatory cascade when they become chronically elevated. Daily garlic consumption consistently reduces markers of systemic inflammation. Your grandmother's kitchen was not just feeding her family, it was protecting them, quietly, every single day, protecting the liver. Your grandmother understood something about the liver that most people today have completely forgotten. She called it keeping the blood clean. Modern medicine calls it hepatoprotection. The result is the same. Garlic contains selenium, a mineral that plays a critical role in liver enzyme function. It contains arginine, an amino acid that helps relax blood vessels in the liver and reduce the pressure that causes liver damage over time. And it contains the allicin compounds that have been shown to activate liver enzymes responsible for flushing toxins from the body. Studies in animals have shown that garlic extract prevents liver damage from toxic chemical exposure. Human studies have found that regular garlic consumption is associated with significantly lower rates of non-alcoholic fatty liver disease. Your grandmother ate garlic every day. Her liver functioned quietly and efficiently for decades, as it was designed to. We are halfway through, 21 benefits, all of them sitting in a bulb of garlic that costs less than $1. I want you to think for a moment about your grandmother's kitchen, the smell of it, the warmth of it, the feeling that in that kitchen everything was going to be all right. Part of that feeling came from her presence. Part of it came from what she was cooking. She knew that food was medicine long before the word nutraceutical was invented. She knew that the most powerful protection she could give her family was the food she put in front of them every day. Stick with me, because the next 11 benefits go deeper. And number 1 is the one she considered so essential, so foundational, that she would not begin her day without it. Improving bone density. Your grandmother did not develop osteoporosis the way many modern women do. She did not take calcium supplements, she did not avoid weight-bearing exercise, and she ate garlic every day. Research has shown that garlic contains compounds that increase the production of estrogen in postmenopausal women, a hormone that plays a critical role in maintaining bone density. Animal studies have found that diallyl disulfide, one of garlic's key sulfur compounds, significantly reduces bone loss in female subjects. A human study found that daily garlic oil supplementation reduced markers of estrogen deficiency in menopausal women. Your grandmother's bones carried her through a long and active life. Her kitchen habits were not unrelated to that outcome. Supporting respiratory health, your grandmother's remedy for chest congestion, bronchitis, and persistent cough was not a trip to the pharmacy, it was garlic. Garlic has expectorant properties, meaning it helps loosen and clear mucus from the airways. Its antimicrobial compounds act directly on the bacteria and viruses that cause respiratory infections. Its anti-inflammatory properties reduce the swelling in the bronchial tubes that makes breathing uncomfortable during illness. She made a simple remedy: crush 4 cloves of garlic, simmer in a cup of milk or water for 10 minutes, strain, add honey, drink warm before bed. Within 2 to 3 nights, the chest loosens, the cough becomes productive, the infection begins to clear. Your grandmother never used a single over-the-counter cough medicine. She had something that worked better, and she knew how to make it: regulating blood sugar levels. Your grandmother's generation had significantly lower rates of type 2 diabetes than ours. The reasons are many, but garlic was one of the daily habits that contributed. Garlic has been shown to increase insulin sensitivity, the body's ability to respond to insulin and regulate blood glucose effectively. Animal studies have found that raw garlic reduces blood glucose levels significantly. Human studies have shown that garlic supplementation produces meaningful improvements in fasting blood sugar and HbA1c, the long-term marker of blood sugar control, in people with type 2 diabetes. The mechanism involves garlic compounds stimulating insulin secretion from the pancreas and improving the efficiency with which cells take up glucose from the blood. Your grandmother ate garlic every single day. Her blood sugar remained stable throughout her life, not by accident, protecting the heart. Of all the things garlic does for the body, what it does for the heart is perhaps the most well documented. Garlic reduces LDL cholesterol, it reduces blood pressure, it reduces chronic inflammation, it prevents the oxidation of LDL cholesterol, the process that causes it to become embedded in arterial walls and form plaques. It reduces the tendency of platelets to clump together unnecessarily, lowering the risk of the blood clots that cause heart attacks and strokes. It improves the flexibility and function of blood vessel walls. Each of these individually makes a meaningful difference. Together, taken daily through food over the course of decades, they form a comprehensive cardiovascular protection that your grandmother maintained without ever visiting a cardiologist. She just cooked with garlic every day for her entire life, and her heart carried her through all of it, repelling insects naturally. On summer evenings, your grandmother sat outside without being troubled by mosquitoes the way most people are today. There were no sprays, no citronella candles, no DEET. She ate garlic regularly, and the compounds that garlic releases through the skin as it is metabolized are deeply unappealing to mosquitoes and other biting insects. This is not folklore. Studies have confirmed that people who consume garlic regularly have significantly lower rates of insect bites than those who do not. She also made a simple outdoor spray. Steep several crushed garlic cloves in water overnight. Strain, spray around the outdoor seating area. Mosquitoes avoid it entirely. Your grandmother knew this, and she enjoyed her summer evenings in peace, improving memory and cognitive function. Your grandmother's mind remained sharp. She remembered everything: names, dates, recipes, stories, the details of conversations from decades ago. Garlic contains compounds that cross the blood-brain barrier and act directly on brain tissue. Allyl cysteine, one of garlic's key organosulfur compounds, has been shown to protect neurons from oxidative damage, the same kind of damage associated with cognitive decline and Alzheimer's disease. Animal studies have found that aged garlic extract improves spatial memory and reduces the accumulation of amyloid plaques, the protein deposits that characterize Alzheimer's disease. Human observational studies consistently show that populations with high garlic consumption have lower rates of age-related cognitive decline. Your grandmother ate garlic every day. Her mind was clear and her memory was remarkable until the very end, treating ear infections. A child comes home with an ear that hurts. Your grandmother knows exactly what to do. Warm 2 or 3 cloves of crushed garlic gently in 2 tablespoons of olive oil over very low heat for 5 minutes. Do not let it sizzle, just warm. Strain the garlic out completely. Test the temperature on your wrist. It should be body temperature or just slightly warmer. Using a dropper, Place 2 to 3 drops of the garlic oil in the affected ear. Plug gently with a cotton ball. Repeat every few hours. The allicin in garlic-infused oil has direct antimicrobial action in the ear canal. The warmth of the oil soothes the inflammation and pain. Your grandmother did not take you to the emergency room for an ear infection. She made garlic oil, and it worked. Please note, this is for mild ear irritation and early outer ear infection. Any severe pain, fever, or fluid discharge requires medical attention. Clearing skin blemishes and acne. Your grandmother's skin was clear, not because she spent money on it, because she understood something that the skincare industry would rather you never figure out. Garlic's allicin has potent antibacterial properties specifically effective against Propionibacterium acnes, the bacterial species most responsible for acne. Cut a clove of garlic in half. Rub the cut side very gently on the blemish. Leave for a few minutes. Rinse with cool water. The allicin reaches the bacteria living in the pore and eliminates it. The anti-inflammatory compounds reduce the redness and swelling around the blemish within hours. Your grandmother did not have a skincare routine. She had a garlic clove in her kitchen, and she knew exactly what to do with it. Always do a small patch test first. Garlic can cause irritation on very sensitive skin, relieving toothache. Before the dentist chair, before pain medication was widely available, your grandmother had something for a toothache. Place a small piece of crushed raw garlic directly against the aching tooth and surrounding gum. Leave it in place for a few minutes. The allicin absorbs into the gum tissue and reaches the nerve endings and bacteria, causing the pain. It has a mild numbing effect on the nerve. It has an antibacterial effect on any infection present. It reduces the inflammation that is driving the pain. Your grandmother did not consider this a home remedy. She considered it what you do when your tooth hurts. It was not a substitute for dental care. She was clear about that. But for the pain in the middle of the night, when no dentist is available, crushed garlic on the tooth was what she reached for. And it gave real relief, removing splinters and drawing out infections. Your grandmother had a remedy for splinters and minor skin infections that most people today have never heard of. Place a thin slice of raw garlic directly over the splinter or infected area. Secure it with a bandage. Leave overnight. The allicin and enzymes in the garlic soften the skin and draw the foreign object or infection toward the surface. By morning, the splinter has often moved to just below the surface of the skin and can be removed easily. For early-stage boils and infected insect bites, the same method draws the infection to a head within 24 to 48 hours. It is not pleasant in the way that pharmaceutical treatments are pleasant, but it works. Your grandmother was not interested in pleasant, she was interested in results, and she got them, supporting healthy weight management. Your grandmother's generation did not struggle with obesity the way ours does. Partly diet, partly movement, and partly garlic. Research has shown that garlic contains compounds that suppress fat cell formation at the genetic level, reducing the expression of genes associated with adipogenesis, the process by which the body creates new fat cells. Garlic also appears to increase thermogenesis, the body's heat production, which means more calories burned at rest. And garlic's blood sugar stabilizing effects reduce the hunger spikes that drive overeating in people with insulin resistance. Your grandmother cooked with garlic in every dish. She was never hungry between meals. She maintained a healthy weight throughout her life with no dietary program and no calorie counting. She just cooked the way her mother taught her, reducing the severity and duration of illness. Your grandmother did not stay sick long. When illness came, and it came for everyone, she recovered faster than most. She stayed in bed, she rested, she drank broth with garlic, and she was back on her feet. Research confirms that people who consume garlic regularly, not just when they are sick, but every day, have shorter illness durations and less severe symptoms when they do fall ill. The allicin acts on the pathogen directly. The immune-stimulating compounds keep the body's defenses strong throughout the illness. The anti-inflammatory properties reduce the severity of the symptomatic response. Your grandmother's garlic broth was not superstition. It was the most effective intervention available to her, and it compares favorably with most over-the-counter cold and flu remedies sold today. Calming anxiety and supporting the nervous system. This is one that surprises people most. Garlic contains compounds, including diallyl disulfide and other organosulfur molecules that influence the regulation of serotonin in the brain. Serotonin is the neurotransmitter most associated with mood stability, calmness, and emotional resilience. Animal studies have found that garlic extract reduces anxiety-like behavior significantly, with effects comparable to low doses of established anti-anxiety compounds. Your grandmother was not a nervous woman, not because life was easy, it was not, but because her daily diet included things that quietly supported her nervous system's ability to stay balanced under pressure. She did not know this. She just cooked the way she had always cooked, and she remained steady through everything. And number one, the benefit your grandmother considered so foundational that she made sure every person she loved understood it. Eating one raw clove of garlic every single morning, not cooked, not roasted, not in a supplement, raw, one clove, every morning, before breakfast, before coffee, before anything else. She called it her daily medicine. She had learned it from her mother. Her mother had learned it from hers. Here is what that single daily habit does. Raw garlic, crushed or minced and left for 10 minutes to allow the allicin to fully form, delivers the highest possible concentration of garlic's active compounds directly to the body. Cooking destroys a significant portion of the allicin. Supplements deliver a fraction. Raw, crushed, eaten fresh. That is the way your grandmother did it. That is the most potent form. And taken every morning before food, the allicin absorbs into the bloodstream before it is diluted by anything else. It reaches every system. The heart, the immune system, the brain, the liver, the blood vessels, the gut, all of it. One clove, every morning. If the taste is too sharp, press it into a small amount of honey, or chase it with warm water and lemon, or mince it finely and swallow it with water like a tablet. Your grandmother did not enjoy the taste, particularly. She took it anyway, because she understood that the most important health decisions you will ever make are not the dramatic ones. They are the small ones, the consistent ones, the ones you do every day without fail, for years, for decades, for a lifetime. One raw clove of garlic every morning. She never missed it, and she was rarely ill, and she lived well, and she was strong, right until the very end. 21 benefits, all of them in a bulb of garlic that costs less than $1, all of them known to your grandmother without a single clinical trial to explain them. She had something better than clinical trials. She had generations of lived experience. She had what worked, and she used it every single day. Are you going to try the morning raw garlic habit? Tell me in the comments. Tell me if you already do it. Tell me how long you have been doing it and what you have noticed. And if your grandmother had a garlic remedy I did not cover today, please share it. This community holds a kind of knowledge that no database contains, and every remedy shared here is a piece of wisdom kept alive for someone who needs it. If this video meant something to you, please share it with someone you love. Not just subscribe, share it. Because the people who need this most are the ones who will never find it on their own. I will see you in the next one.